This is Dr. Lori Gardner with a brief lecture on childhood trauma. Childhood trauma refers to distressing or disturbing events experienced during childhood that overwhelm a child's ability to cope or process the experience. These traumatic events can range from physical or sexual abuse to emotional neglect, witnessing violence, things like parents fighting, always fighting, or experience a loss such as the death of a parent. Trauma can be categorized into two main types. Chronic trauma. Oops. Let's see if we can get this back. And acute trauma. Acute trauma results from a single overwhelming event such as an accident, a natural disaster, or a sudden loss, whereas chronic trauma occurs over a prolonged period such as ongoing abuse, neglect, living in an environment of violence. Then there's complex trauma, and that refers to repeated exposure to traumatic events, often involving interpersonal relationships such as ongoing abuse or neglect in childhood. And these experiences can deeply affect a child's worldview or their sense of self. Most experts believe that physical and sexual abuse result from a combination of factors within both parents and children, often in multi-problem families with significant instability. Some of the important risk factors include parental mental illness or substance abuse, lack of social support, poverty, minority ethnicity, families that have 4 or more children, maybe young parental age, a parental history of abuse, stressful events, and exposure to family violence. Although sexual abuse is prevalent in all socioeconomic classes, physical abuse and neglect may be more common in lower socioeconomic classes. However, abusers have racial, religious, and ethnic distributions similar to those of the general population. Some risk factors include child prematurity, intellectual disability, and physical disabilities as well when you consider the child. Childhood trauma impacts not only emotional well-being, but also brain development. The brain of a child is particularly vulnerable to stress as it's still growing and developing. Prolonged exposure to stress can lead to changes in the brain structure and function. The stress response system, under normal circumstances, when a child is faced with stress, their body enters the flight or fight mode, releasing hormones like cortisol and adrenaline. This response helps the child to deal with immediate threats. However, in cases of trauma, especially when stress is chronic or overwhelming, the stress response becomes dysregulated. This can lead to heightened levels of cortisol, which over time damages brain structures such as the hippocampus, and that's critical for memory and learning. And the prefrontal cortex, which is important for decision making and emotional regulation. Changes in brain development studies show that Children who experience trauma may have an underdeveloped prefrontal cortex, leading to difficulties with impulse control, emotional regulation, and complex problem solving. Additionally, the amygdala, responsible for processing emotions and fear, may become overactive, leading to heightened anxiety and fear responses and emotional instability. Childhood trauma affects various areas of development like emotional, social, cognitive, and physical health. Children who experience trauma may struggle with emotional regulation. They may develop intense feelings of fear, anger, or sadness, and these emotional difficulties can extend into adulthood, leading to mental health issues such as anxiety, depression, and PTSD. Socially, traumatized children may have trouble forming healthy relationships. They may struggle with trust and have difficulties forming friendships or engaging in positive social interactions. Some children may display aggressive behaviors, while others may withdraw socially. Cognitively, trauma can impair cognitive functioning, including attention, memory, and executive function. Children with trauma histories may have difficulty focusing in school or may struggle to process complex instructions, leading to poor academic performance and difficulties with learning. And physically, studies have shown that children who experience trauma can lead to long-term health consequences. Traumatized children are more likely to develop chronic health conditions such as heart disease, diabetes, and obesity later in life. The body's prolonged state of stress leads to an overactive immune system, which can weaken over time. The forensic evaluation of a child should be performed by a clinician trained in forensic assessment. This individual should not be the physician or therapist that's involved in the ongoing treatment of the child. And of course, confidentiality issues must be clarified before a forensic evaluation. The fact that an evaluation is being done for court proceedings needs to be made clear to the parents and the child from the very beginning. So children will be assessed for all of these changes, behavioral changes, emotional changes, physical symptoms, academic struggles or problems they may be having, and regressive behaviors. But remember that forensic evaluation is not done by their pediatrician or the therapist or the provider involved. It should be someone who's trained in doing a forensic assessment. Children may show withdrawal from social activities, sudden outbursts of anger or aggression, or acting out in ways that are unusual for the child. So these are some of the things to look for with these children. They may have unexplained sadness, extreme anxiety, extreme expressions of fear, or depression. They may also exhibit emotional numbing or detachment. They may complain of headaches, stomach aches, or other physical ailments that don't have a clear medical cause. They may show a decline in school performance, inability to concentrate, or difficulty following instructions. They may also return to earlier developmental stages and show signs of regression, like bedwetting, thumb sucking, or needing to be comforted more than usual. The good news is that healing from childhood trauma is possible. Early intervention, supportive relationships, and therapeutic approaches can help children and adults reclaim their sense of safety and well-being. One of the most effective ways to help a child heal from trauma is through the presence of caring, supportive, and consistent adults. And this can be from family members, teachers, counselors, mentors who provide a safe environment for the child to express themselves and feel valued. Some non-pharmacological treatment includes trauma-focused cognitive behavioral therapy, or TFCBT. And this is a structured, evidence-based therapy that helps children process traumatic memories and develop healthy coping mechanisms. Play therapy is good for younger children. It can be a powerful tool to help them express their feelings and process trauma in a non-verbal way. And then there's EMDR. It's used for individuals dealing with PTSD. And it helps process traumatic memories in a way that reduces their emotional charge. Building resilience is the ability to bounce back from adversity. Encouraging resilience in children involves providing emotional support, teaching coping strategies, and ensuring a stable and nurturing environment. Community support is essential because trauma doesn't only affect the individual, it affects families and communities as a whole. Community-based programs provide access to counseling, support groups, and educational resources that help families cope with the long-term effects of trauma. So let's talk about child abuse versus child neglect. In the Child Abuse Prevention, Adoption, and Family Services Act of 1988, physical abuse was defined as injury of a child under 18 years of age by a person who is responsible for the child's welfare, under circumstances which indicate that the child's health or welfare is harmed or threatened. For the National Incident Study, physical abuse was defined as a child under 18 experiencing non-accidental injury, like harm or a risk of injury, which is the endangerment standard, as a result of being hit with a hand or other object, having been kicked, shaken, thrown, burned, stabbed, or choked by a parent or substitute. Child neglect is differentiated from child abuse and refers to the failure of the responsible caretaking adults to provide adequate physical care and supervision. So, child abuse or physical abuse versus child neglect. Social neglect, okay, that is the absence of adequate caregiving during childhood. It's a diagnostic requirement of both reactive attachment disorder and disinhibited social engagement disorder. So, social neglect is that of absence of adequate caregiving during childhood is a diagnostic requirement of both reactive attachment disorder and disinhibited social engagement disorder. And although the two disorders share a common etiology, the former is expressed as an internalizing disorder with depressive symptoms, and withdrawn behavior, whereas the latter is marked by disinhibition and externalizing behavior. Reactive attachment disorder is characterized by a pattern of markedly disturbed and developmentally inappropriate attachment behaviors in which a child rarely or minimally turns preferentially to an attachment figure for comfort, support, protection, or nurturance. The essential feature is absent or grossly underdeveloped attachment between the child and putative caregiving adults. Children with reactive attachment disorder are believed to have the capacity to form selective attachments. However, because of limited opportunities during early development, they fail to show the behavioral manifestations of selective attachments. And I went over reactive attachment disorder and disinhibited social engagement disorder in the previous lecture. So let's talk about some of the different types of child abuse that we see. Burns, fractures, head injuries, infections, and these are just a few. But head injuries are the leading cause of traumatic childhood death, and of child abuse fatalities. So head injuries are the leading cause of traumatic childhood death and of child abuse fatalities. Special attention needs to be paid when examining an infant or a toddler for physical abuse. The term whiplash or shaken baby syndrome describes a constellation of clinical findings in infants and toddlers, including retinal, subdural, or subarachnoid hemorrhages with little or no evidence of external cranial trauma. It's postulated with whiplash forces cause subdural hematomas by tearing cortical bringing veins. Serious injuries in infants are rarely accidental unless there's a clear explanation. So that is pretty much it. Like I said, it would be a brief lecture on childhood trauma. And if you have any questions, please let me know.